Good morning, everyone. This is Dan Spencer with the Bellingham Board of Selectmen. It is Thursday, April 15th, 10 a.m. We are here to do our daily update with regards to the coronavirus and its effects on the town and its residents. As per usual, we'll start off with Deputy Chief.
Good morning. Thank you, everybody, for tuning in. We'll start off with the numbers as we always do. Massachusetts, 29,918 cases. We have 1,108 deaths. The U.S. count, 644,348 cases with 28,554 deaths. The worldwide counter is 2,096,709 cases. We have 135,662 deaths, with a very good number of 523,356 who have recovered. At this time, we'll change it up a little. We have in our studio Chris Kent and Anthony Bavozzi, representing the police and fire departments. So we're just going to get a little insight from them. We'll ask them a couple questions, and we'll go from there.
Yeah, thanks for coming in, guys. And we hear a lot about the first responders and the work that is being done nationally and throughout the state. And a lot of times we lose touch with the men and women in our own community that are out there every day. And certainly appreciate all that the two of you and the departments are doing. We wouldn't be able to effectively manage this issue and protect the citizens and the residents of our community without the dedication and the workload I know has increased dramatically over the last month or 2 months. The anxiety in the community is heightened. We get a bunch of emails every day, and the theme seems to be, what can we do to protect ourselves? And oftentimes people lose touch with the fact that fire and police, you're in the front lines. I'm sure that it has an effect on yourselves, your families, and we can't tell you how much we appreciate all that you do. But I wanted to start with Chris from a firefighter perspective. Maybe you can just tell us a little bit about how life has changed as far as being a firefighter, the way that you respond to calls now, and the preparation that you have to take, knowing that every call could be something where somebody's sick with the virus.
Well, a couple of things have changed. Now in the back of the ambulance, we have a new kit that's specifically for COVID or coronavirus potential cases. It's every call that you go on, you have to anticipate that this person may be affected by this and may not be showing symptoms. So we be really, really careful with how we handle people, how we interact with them. When normally we would just head right into a house and start interviewing somebody who's sick or needed help. And now we're asking people to come to the door or come outside. If they don't have a mask, we try to get a mask on right away. And then the rules from the Offices of Emergency Medical Services are kind of loosened for us so that we can almost treat and release people, so we don't actually have to bring them to the hospital and potentially expose them if they're not already exposed. So it's a lot going on. It seems to be changing kind of day to day, maybe more adapting day to day. It's strange out there. Things are very different.
Because we hear a lot about PPE and the lack of PPE out there nationally throughout the state, and states are outbidding other states for PPE. We put an emphasis on that here, and can you tell us, has the department had adequate PPE up to this point to protect yourselves?
Yes, we have had adequate PPE, but that's also taken a tremendous amount of legwork, specifically by the deputy board. I mean, you got to beg, borrow, and steal for some of this stuff. It's very the supplies are very short, and they seem to be. I believe it's MEMA that's kind of overseeing the stockpiles, and they're distributing kind of as needed to local fire departments. And alternatively, we could go to a private supplier and obtain the stuff directly, but most people are sold out of things. So we're doing what we can to keep ourselves protected, and we have N95s, KN95s. We're using Tyvek suits. We just got some face shields. One of the guys on the department, his son, develops, I think it's car seats, and his company's switching over, and they're going to start making face shields. So a lot of people are offering things to us that that we wouldn't normally obtain. That they're offering things that we wouldn't normally get. We go to a private school.
That's great. I want you to know that's been an emphasis for us here to try and make sure that that's not an issue. We don't want to get to the point where we're asking you to turn masks inside out or whatever, some of the crazy things that have been out there. So we've been on that, and I know the deputy's been on that, and the fire chief's been on that. We've been on that. That's been one of the most important things for us, is to make sure that you guys are protected out there.
We got some cleaning devices too for that. I think you got them from the school.
Correct. We borrowed some devices from the school, the ultraviolet cleaning. With them not being there, we're capable of, when we return, we could take our masks that were used, put them in the ultraviolet, and clean them. We're in a reuse policy right now. So we get 5-time use out of our N95s. And now it just gives them a little bit better feeling of, hey, at least I did another type of cleaning to try to get a little bit more life out of that N95. So we thank the school for that. They did a great job and stepped up. And one of our firefighters, Lieutenant Milo, reached out to the school and was able to capture that for us. So that's good news.
Anthony, how's the police department doing?
Certainly, anxieties are heightened. I'd say both within and outside the department. I mean, even our interactions with the public, how people are nervous. My guys have really stepped up. I mean, they've done a really good job pushing for a lot of stuff. Luckily, we have a relationship with a lot of the businesses in town, and they've been fantastic about getting donations, to us to get some of these masks and the gloves and whatnot, because as you stated, there's certainly a shortage on the PPE. So we've been fortunate again to have a lot of these local businesses and working with the DEF to try to get some of these things that we need. But it's discouraging to think that it's the shortage exists. I mean, here we are on the front lines running into these homes sometimes where you don't have that luxury of waiting and wondering if you're going to have the appropriate equipment, whether it's that N95 mask, the nitrile gloves, the gown. And as you're driving, to that call to try to respond, how is it that you're preparing to go into that home? How are you slipping on gloves and a mask? And, for both careers, really, time is of the essence. So now your anxiety is heightened going into the unknown to begin with. And then on top of that, you're adding the stress of, how am I putting all this stuff on and getting ready for this call? And, they talk about social distancing. Well, yeah, in this career, social distancing in both careers, really social distancing is not, again, a luxury that we have. So try to keep in mind, out of respect for people and even the folks that you work with, you go into everything carefully and you hope that people appreciate what it is that you're trying to do. As Chris mentioned, it's someone calls pulling people out of the house so you're not going inside. Just trying to maintain the 6-foot distance. It's handling a lot of calls over the phone where we'd be doing a lot of things in person. We're still out there. We're still being proactive. We're still looking around. We're watching things, right? Luckily, with the stay-at-home order, a lot of the traffic has died down. A lot of the activities in the stores are closed. So our focus has now really become patrolling those areas that are still densely, visited, whether it's the market basket lots, the stop and shop lots. It's a different focus. It's the same focus that you have, but adding that extra into it. So the playgrounds, the fields, making sure, that people are distanced appropriately when they're waiting in these lines and aren't getting too close if they're on the track. And it's become kind of tedious in a sense, but, for the sake of everyone's safety, it's what we've been asked and it's what we're doing. So the focus is kind of, there's more focus on, you hate to tell a kid and his father and a bunch of friends to get off the football field, but again, it's what's being relayed to us is to keep people safe, and that's what we're doing. So back to the original with the PPE, we need more. It's tough. I mean, I'm glad that businesses are stepping up and, making stuff that maybe they normally wouldn't and donating these things, but it's been difficult to get our hands on some of the stuff that we need to make us comfortable going in and dealing with the public, because then, one point that a lot of times we don't take into account is now we go home to our families, right? And we have to worry about our exposure and our interaction with these folks. And again, not having the luxury of keeping that 6, 10, 15-foot distance sometimes, what are you doing if you are coming into contact with someone? You know, how are you decontaminating, disinfecting? How are you, a lot of us have to change the way we do business even when we go home. You know, maybe it's stripping down in the garage and taking a shower before we go in, and having a plan with our significant other, our spouses, our friends and family. God forbid something happens, I got to quarantine in the garage in the basement. We talked about it. Where are we quarantining? It's kind of heightened anxiety both in the public and in the department. But my guys have been doing really well. They've been stepping up. They've been coming up with a lot of creative ideas. They've got a lot of donations from places, and we're doing the best we can with what we have.
You're doing an outstanding job.
Appreciate it.
Absolutely. It's reported all the time that the highest incident of the disease seems to be among first responders and in the healthcare, because you people are in the front lines. Certainly respect that and recognize that.
So just kind of piggybacking on what you were talking about with, a lot of times people looking at firefighters and police officers as police officers and firefighters, and not kind of realizing that when they get home on duty, they're with their families. So how you talk about, the changing of, when you get home as well, a lot of times people will sit here and say, okay, well, we can't have, this firefighter if he tests positive. Now, the big thing is don't infect the firehouse, but there's also the chance to infect your own house. So that being said, what would you like the public to do, or how they can be more cooperative when responding on calls? And I know sometimes you say come out of the house first, or maintain the 6-foot distance. But is there anything else that you'd like them to do? How do they act? And I guess people may be more cooperative with a firefighter than with a police officer, depending on the nature of the call. But from either one of you is what the message you'd like to get to the public to
say that just have an understanding that things are dangerous for us too. So we're going to keep our distance. Our interactions may be a little bit different than they might otherwise be, but just understand that we're trying to keep ourselves safe just as much as we're trying to keep, our residents safe. Or somebody who needs to go to the hospital safe. Okay. So things might move a little bit slower, a little bit more careful as far as rescue calls go, but a little bit of patience and understanding will go a little bit.
Listen to the recommendations of, health officials, government officials. Just stay at home. If you don't need to go out, don't go out. When you do go out, protect yourself and protect other people. Make sure you have your masks, your gloves. Appreciate and respect the 6-foot rule. A lot of these businesses, like, call it Market Basket, Whole Foods and whatnot, Home Depot, they've done a good job marking out spots on the ground to keep people kind of spaced out. And believe me, we're getting the calls. Hey, someone's getting too close in line, they're making us uncomfortable. Our guys are immediately responding down there to try to make sure that, as much as you don't want to call it a threat, but the threat isn't there. So just listen to what people are telling you. It's for your own good. Maintain distances, be respectful. When we interact with you, just understand again that we're people too. It's not just a badge. It's keep your distance. Let's talk. Let's interact. Be cooperative, respectful. Let's get through this together.
So basically, in a nutshell, for the folks watching, be cooperative. Do what's asked of you. It's our obligation as residents to protect these folks as much as it is for them to protect us. So, got to make sure we're doing the right thing.
And we've been receiving a tremendous amount of gratitude and support from the great town. So that's really, really appreciated. And I should note that the government is trying to pass a bill that would protect us if we got sick, to protect our rights and our benefits, and we protect our families so if we were to infect them. Representative Soder co-signed the bill, so we appreciate that. It's a big help.
Yeah, again, there is a lot of support from the public. It's obviously we don't get the amount of walk-ins and the donations, because those things at this point, we kind of put a halt on for everyone's safety. But people are sending emails that are going on social media and reaching out and thanking us. And if you see them on the street, they're giving you a wave and a holler. Again, like Chris said, there's a lot of people in positions that are looking out for us as well, whether they're trying to pass bills to cover, any type of illness or whatnot, try to get us to PPE, or even recently with the testing for first responders. Call it 2 weeks ago, a week ago, you had to show signs and symptoms. You had to have that guaranteed exposure to go down and get a test. Now there's been some changes, and correct me if I'm wrong, but now for first responders, you can go down and get that test without those signs and symptoms, which,
You're right, the Foxborough
Yeah.
Location is now allowing that,
and I
yes.
know a few of my people have already expressed interest, and some of them have not, because it's something that when they go home to their own family, or when they come into the police department, they want to make sure, we also have people that are vulnerable to these things, okay, whether it's age-related, health-related. You don't want to have, this thing brought into your home, your station. So for peace of mind, a lot of people are reaching out and, utilizing those services. So it's good that they exist.
As a manager of the fire department, I'm pretty proud of the police and fire working together. We have the opportunity of having a washing machine and dryer within our facility. Both stations have this, thanks to Chief Gentile, who saw the future and said, "Hey, we need to get these when they get blood or anything else on their uniform." So now we're working with the police department. If they feel that they've been contaminated, they can change in the station, bring their contaminated clothing over, and have that laundered at the fire station now. So it's kind of like out of all the departments in the town, the police and fire are kind of like, we know we're on the front lines. We have to work together. So, all these things are pretty important, and we're trying our best to try to help each other. So, I mean, we all go on the same calls, right? I mean, it's just a little different now, so we used to have the police in there helping us every step of the way. Now they have to step back a little bit. We don't even have all the firefighters going in to a call at once now. Everybody takes their turn going in. Do we need more personnel? Yeah, we'll bring this person in. Is there some kind of domestic going on? Well, now we need the now we need the police department to come in. So it's, as Chris said that at the very beginning, it's the same business as usual. We just have to change our tactics. And I'm pretty happy to say that we've come a long way, and we're doing really well. So thank you.
No, just appreciate you guys coming in and sharing with us.
Thanks for having me. Appreciate it.
Thank you guys.
Thank you guys very much. Appreciate it.
We know you're on duty.
Be safe out
All
there.
right. Thanks, gentlemen. All right. Going back to order. How about Esther, public health nurse?
Good morning. Couple of things before I give numbers this morning. I wanted to address the discrepancy that you may see in the numbers that are reported from the state versus the numbers that I report. The state will only report confirmed cases that have been tested. There are some cases that are being clinically diagnosed by their providers. And what that means is the doctor has said, yep, you definitely have COVID-19. There's no need to do a test. We're going to treat you as you have COVID-19. I'm also responsible for following those patients as well. So they are included in my numbers when I give them to you. So as of this morning, we have had 36 confirmed cases. Currently, we do have 21. There were some questions regarding the recovered cases versus the confirmed cases. The confirmed cases is the total number of confirmed cases. So currently active, we do have 21. Still holding at the 15 recovered. A total of 161 residents have been tested. And we had some sad news this morning. We did have our second death to report.
And just so trying to clarify, what constitutes someone being recovered?
So the current CDC guidelines for recovery basically states that you have had at least 3 days of no fever without the use of Tylenol or ibuprofen, with improvement in your symptoms, or at least 7 days from symptom onset. And that constitutes recovery. It is thought that you are no longer shedding the virus. You are no longer contagious at that point.
Great, thank you very much.
You're welcome.
Bruce? Yeah. So, report from the Board of Health.
Good morning. Just want to make people aware that, when you're out shopping, you really should be wearing your mask, gloves if you have them, or, be sure when you're washing your hands frequently, you go in, you touch the surface, go out, wash it. If you carry sanitizer in your car, that's highly recommended. And again, you know, when you come out of the store, make sure you dispose of your protective gear in a proper facility, or ask for an extra bag at the counter and put it in the bag, take it home and dispose it when you get home. I'm concerned that, you know, when you're in the store, that you want to be social distancing. We're not sure who has it. You could come into contact with somebody in the store if they don't know they have it. So we want you to, be safe, maintain that social distancing. And at this point, I think wearing a mask is highly recommended. The governor's recommended it. I'm recommending it. Mark is recommending it. Let's try to.
I'll recommend it too.
If you're out there, if you don't have a mask, wear a bandana or a scarf, something like that, because it is, you don't know who has it. There's a lot of it out there yet that hasn't been tested. And I hate to see somebody come in contact with it. The stores are your biggest bottleneck of people. They're doing what they can. Please pay attention to what the stores, doing for their policies of, the one-way traffic, counting the numbers coming in and out, maintaining the distance outside in line, trying to get in. It's a big push here. We're at the peak, according to the governor. So let's all do our part and maintain. Don't go out unless you have to. Stay home.
Just a couple things regarding the masks, and Esther, you can jump in as well. It's my understanding that the homemade masks are going to give you yourself kind of a limited level of protection, but it's almost more geared to, in case you're a carrier and don't realize it, you're going to prevent spreading
Right, it protects.
right?
It's a double-edged sword. It protects both ways.
Okay.
Yeah, and you do have a higher level of protection for other people when you're wearing a scarf or a handmade mask. And that is because there are a lot of people that have no symptoms. They do not know that they're positive. And since there isn't statewide testing, so you really are protecting the most vulnerable when you wear a handmade scarf or mask.
All right, great. And then the other question that I have, again, for either one of you is, somebody asked me, are stores or establishments still taking paper money, or are they requiring you pay with a card, a debit card, or a credit card? Has there been any advice? There's been no advisories about lacking.
Unfortunately, cash is still currency.
Yeah, right.
The majority of people, when I'm in line, and I've been frequently just trying to get to each store once a day, the majority of people are using plastic, and then they're touching the ATM machine or the card reader. Obviously, the card reader and the ATM machines need to be clean, but then they're not clean between every person. So there is a contact surface there that's at risk.
So regardless of whatever currency you're using, as soon as you're done with the transaction, sanitize your hands, wash your hands. It's always going to be the safest bet.
And the best thing I heard was bring a Q-tip with you to punch the keypad. Yeah. I thought that was a brilliant idea, and you could just dispose of the Q-tip properly. But bring one with you.
Q-tips, not just for your ears.
That's right.
All right. Every time we have this meeting, we always solicit any comments, questions, or concerns to achieve the proper, accurate information. So we ask you to email us at covid19@bellinghamma.org. Dennis, do we have a few questions overnight?
We have a few for Esther. A resident wants to know about the 35 positive cases if the people are hospitalized or at home recovering. And Esther and I talked a little bit about this off air, and there's really no way of reporting that, and there are some privacy issues. So it's not something that we would necessarily update or report, correct, Esther?
Correct.
All right. Here's an interesting one for you. I found some bottles of hand sanitizer in the back of the closet. They are alcohol-free. The active ingredient is DKZ 0.13%. My question is, they expired in 2011 and 2016. I can't find hand sanitizer. I don't want to use something that doesn't work. And coincidentally, Dan had a DZK antiseptic towelette, and they are alcohol-free, and his doesn't expire until February of 22. So that's the type of thing I think
nice work.
Is talking about. Theirs expired 10 years ago. Are they any good?
So here's the thing. Alcohol-based sanitizers are the only hand sanitizers that are recommended by the CDC to kill the coronavirus. The alcohol-free ones are not recommended for the coronavirus. For other regular everyday use, yes, they're fine. They're less harsh on your hands. So number one, it's not going to be effective against the coronavirus, whether or not it is expired. If you have an alcohol-free, an alcohol hand sanitizer that is expired, that will still be effective. It just may lose some of its efficacy after expiration. Because they're controlled by the FDA, they have to have an expiration date on them, but the alcohol ones have alcohol, so they will work to some extent for hand sanitizing.
Great, they're vintage hand sanitizer. Okay. The final question we had, in clarification actually, as much as anything, had to do with the food pantry and St. Blaise Food Pantry, Loaves and Fishes. And I know, Dan, you were going to touch on that.
Yeah, so we're looking to get them to come in the studio and kind of talk about, in the studio again, and talk about, what their, how many meals they're distributing, or how much food they're distributing, what their process is. But I do know at this point they are looking for donations to keep that pantry. You drive by the St. Blaise Church on any given day and you see lines of cars lining up, and they've got them ushering in 2 at a time, and they're providing some much needed food and groceries for folks. So if you have the capability and you can make a donation, please consider donating to the St. Blaise Food Pantry. And again, we're going to try to have a representative from the food pantry come on in and give a little more detail than what I have. Thanks. Great. All right. Anything else?
And before we sign off, I actually wanted to address a couple of things that I saw on social media. There have been a lot of questions and concerns regarding whether or not you have been exposed to the virus. You have to understand, if you have been exposed to the virus, you will be notified, either by myself or by the public health nurse in your town. There is very strict criteria that is required for you to meet the definition of exposure, but that you will be notified if you have been exposed, and you will be instructed to the proper steps that you will need to take. Also, please make sure you're getting your information from reputable sources. There is a lot of information out there. Not all of it is true. Just verify what you're reading or you're hearing. And again, send us questions. If you do have any questions, we'll give you the most accurate answer that we have for you.
Thank you. We did have one other email that came in, and they were very complimentary towards Esther and the work she's doing to get the word out in this committee. But they especially love your different backgrounds, Esther. You
I have to keep them happy.
Right. In Esther, we trust.
There you go. So anything else from anyone? All right. If not, I just again want to remind, kind of dovetailing what Esther said, the purpose of doing these broadcasts is to provide you with the most updated and accurate information. While Facebook can be a great social platform, it's not always going to be the most accurate. We have a wealth of knowledge sitting behind that TV screen with Esther. If you have any questions, comments, concerns, please email COVID-19@bellingham.org. And we will get that question, comment, concern addressed as soon as possible. Mark?
Okay, and usually we end with some phone numbers, but I would like, as everyone may or may not know, we have our 9 o'clock meeting with all of our department heads. We spoke with the senior center today, and she was just like to ask everyone out there to check on your seniors, give them a call, have a conversation with them, make sure they're okay, make sure they're feeling okay. Just plain check on them, and see if you can make their day by giving them a phone call. And with that said, if you have any COVID-19 questions for the state of Massachusetts, you can dial 211. If you have any work-related issues that you would like to discuss, you can call the Mass Attorney General's office at 617-727-3465. Thank you very much.
Thank you very much, everybody. Remember to maintain social distancing, sanitize, 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 and wash those hands. Thank you very much. Have a good day.
Bye.
Thank you.